Hello, students. I thought I'd go over some things for one of your work assignments for lab number 6, and we'll have a little discussion about a case scenario. In the case scenario, we're compounding diazepam suppositories, and this is a case where um, diazepam suppositories are a good choice because they're used for seizures. And so, as part of your assignment, I'd like you to answer some questions. What is status epilepticus? What are the types of epilepsy? Their older names are grand mal and petit mal. We have generalized partial seizures, that's their name. So I want you to review your epilepsy, and let's talk about, is diazepam the drug of choice for something like status epilepticus? Is it used in the pediatric population? What dosage forms is diazepam in? Diazepam, or Valium is the brand name, is a drug you should be very familiar with. So what kind of pharmacokinetics does it have? What's its half-life? It's one of the classic benzodiazepines. It was one of the first ones ever invented. It's been around for a long time. So you should know a lot about diazepam. And in this case, the pharmacist compounded diazepam suppositories using cocoa butter base. And the question is posed, was that a good idea? Okay. And the patient kept having seizures. So something wasn't working right. So Dr. Hussein will go over specifically about lipophilic and hydrophilic drugs and their absorption into the base. But in this case, the choice of cocoa butter, or wool fat is the old name for it, was a poor choice. So the PEG is the better choice. So the choice of the cocoa butter lowered the bioavailability of the drug to the point where it wasn't therapeutic, and the patient didn't have seizures. So this brings up a very interesting subject that I would like to teach you about, and that is how you handle mistakes as a pharmacist. Now, in Virginia, we operate with what's called a PIC, a pharmacist in charge. Every other state would have a pharmacy manager. So that's probably the PIC's job, to take care of notifying prescribers about mistakes, notifying your employer, and the processes and policies involved that. But they may not be available, and any pharmacist needs to know how to properly handle informing people, patients, and prescribers about mistakes that have been made in the pharmacy. We hate to think about mistakes, but we're human and mistakes happen. So the first thing you got to remember is to be honest and empathetic. You're sorry that this happened, genuinely. And don't volunteer too much information, but never lie about anything and try to assign blame. So you want to be honest to the point, give accurate information but not too much information, and then ask them if they have any further questions to contact the pharmacist in charge, or the manager, the pharmacy manager. So if this particular mistake had occurred and the doctor's office left a message for me to call them back about it, it would go something like this. Ring, ring. Hello, this is John over at the pharmacy, and I'm one of the pharmacists here, and someone called about the diazepam suppositories and that they weren't working for Mr. Jones. We took a look at that, and the base that was used to make those was probably not the best choice, and we're going to refund that prescription and make it again with a different base that should work better. And you can send the patient over, and we will take care of that. And we're sorry that this happened, but we could have used a better base, and we're going to do that now. And if you have any questions, give me a call back, or you can talk to Bob. He's our pharmacy manager here at any time. And we thank you. Take care. Bye-bye. So, again, be empathetic to the point of you're genuinely sorry that it happened, but don't say, "Oh, I wasn't the pharmacist that filled that, and he's a dummy, and he shouldn't have done that." I mean, obviously, you don't want to say anything like that, but you'll get a tone of voice sometimes about blame. So this is a subject that you need to review what you've been taught in the subject, how to handle and communicate mistakes with prescribers and patients. And be careful about what you say to the patient too about admitting things, because you could end up in court very easily, and the lawyers are going to sue everybody. They sue the doctor, they sue the pharmacy, they sue the pharmacist, they sue anybody involved. So be careful what you say. Document everything you say. Write it down, record it on your phone, take a video. You need to document all incidents. And again, be honest, empathetic, and to the point. I want you to understand why this is a mistake, why the bioavailability of the drug was affected by the compounding knowledge that you need with diazepam, and the knowledge of the drug and the knowledge of the bases is what caused this error. So this is why compounding is important, and this is why it's a necessary part of your skill set as a PharmD. So anyway, I just wanted to talk about that and give you some further thought and a further assignment. Look up the indications for the type of epilepsy and where diazepam is used. What other dosage forms to administer diazepam for patients that have seizures are there out there? There's a product called Diastat, which is diazepam rectal gel. What's the base in the rectal gel? How is the rectal gel applied? Is there a locking ring? This is something I'd like you to research. Research the product Diastat and the generic forms of Diastat, and I'd like you to get to know that, and maybe we'll talk about that or have a quiz about it. So if you were making, instead of suppositories, and you wanted to make diazepam rectal gel, what would be a good choice for your base? How would you make the base? What kind of packaging would you put the rectal gel in so that it could be applied? What if it was a pediatric patient? I'd like you to think about all these questions, and this is a very good work assignment, and we'll get back to you about this soon. Take care. Bye-bye.